Governor Newsom is holding a briefing where he's updating the state's reopening plans after we hit 20 million vaccines administered.
For everybody 65 and over, 50% of folks now getting their first dose is substantially higher pace of administered doses than the rest of the state. So I want to compliment you, Mayor, on your extraordinary job, compliment the partnerships that you have established, including the partnership here with UCSF, the community college site, a site that, as the mayor proudly told me, has the capacity to administer over 5,000 shots each and every day. The only constraint is manufactured supply. And I want to remind everybody that we are designing a system here in the state of California that can provide upwards of 5.8 million vaccines to be administered on a weekly basis. Currently, we are receiving about 2.5 million. But we've designed a system that includes this site here that allows us to more than double that capacity. In anticipation, with expectation, that we will be receiving more vaccines. You had noted that everybody now in the state of California, 50 years and up, is now eligible to receive their vaccine. We began that process, established that threshold on April 1st. We are encouraging folks that have not yet signed up to go to My Turn, the statewide platform, to reach out to learn about most proximate site for where you are living to get these doses administered. Today, in the state of California, we are proud to have passed two significant milestones. 20 million administered doses in the state of California and 4 million administered doses under the more important equity metric. Those two milestones, let's put it in perspective, are significant. We have administered more doses than all but 5 nations in the world. The state of California, that 20 million mark, represents over 7 million more doses than any other state in the country. That 4 million on the equity mark, to me, though, as I noted, is more important and significant. This state set a commitment and a audacious goal of providing over 40% or upwards of 40% of all our first doses and providing them under an equity metric in order to deliver on the cause of equity. We still have a lot of work to do in that space. We're mindful of that. But that 4 million mark is as important as the 20 million mark. And today we have formally passed that. So what does that mean? It means a number of things. We're seeing death rates, mortality rates go down. We're seeing case rates stabilize. We have the lowest case rates in the United States of America. Over a 7-day period now, we have a 1.6% positivity rate statewide. We report today 1,367 cases, still prevalent, still deadly, still a challenge that we need to tackle. And that's why we are mindful, as the mayor said, of the imperative and importance of not letting your guard down, not taking off your masks, maintaining your vigilance, and accessing, once your eligibility comes up, these vaccines. In anticipation and expectation that we do all of the above. And by the way, I'll repeat, continuing to wear face coverings, continuing to access vaccines and continuing to administer vaccines in an equitable framework. If we keep the pace, we are moving now beyond the blueprint. We are announcing today that on June 15th, we will be moving beyond the blueprint and we'll be getting rid of the colored tiers. We'll be moving past the dimmer switch. We'll be getting rid of the blueprint as you know it today. That's on June 15th if we continue the good work. We anticipate enough vaccines are coming into the state of California. With 2.5 million people just last week receiving the vaccine, we anticipate over 30 million people will have been vaccinated at least one dose by the end of the calendar month, with the expectation of an abundance of doses coming in from the federal government through the end of this month and into May, we can confidently say by June 15th that we can start to open up as business as usual, subject to ongoing mask wearing and ongoing vigilance. So this is a big day in terms of the pandemic and the journey that we've been on, as the mayor noted, over the course of the last year. And this is an important milestone today, that 20 million and 4 million equity mark. And this is a compliment to all of you, to the mayor, to all the work that's being done by local health officers all up and down the state of California. At the end of the day, the state vision is realized at the local level. And so, again, I want to just congratulate and applaud all the local partners, the community-based organizations, all the work that's being done in a very culturally competent manner, in language, all across the state of California, and that real commitment, again, to delivering on the issue of equity. And so I want to thank the mayor. I want to thank Dr. Colfax. I also want to thank Dr. Ghaly, who has led the charge. We've had a blueprint in place in this state for 31 weeks now. And by the way, 16 counties are moving today into less restrictive tiers in that blueprint, which is further progress. But no one has been more enthusiastic than moving beyond the blueprint than Dr. Ghaly, but soberly and thoughtfully, led by data, led by disease prevalence, looking day in, day out, hospitalizations and ICUs, tracking these mutations, and I'll close on that point. We're very mindful of the variants. We're very mindful of mutations. We have sequenced as much or more than any other state. The genomic sequencing that this state does is second to none. 851 UK variants we have sequenced in the state, 10 South African variants, 35 Brazilian variants, close to 9,400 West Coast variants. And we are also tracking a number of other variants, new one from India, which got a little bit of attention this week, this double mutant, this double variant, and also mindful of variants coming from the East Coast, including a New York variant. This is really a race, these vaccines, against the variants, against the mutations. And that's why, again, I will end as I began. It is incumbent upon all of us not to announce mission accomplished, not to put down our guard, but to continue that vigilance that got us where we are today, the lowest case rates, positivity rates, that is, in America. We are seeing bright light at the end of the tunnel. And on June 15th, all things being equal, we continue that good work. We'll have moved beyond that blueprint, and we'll be opening up this economy at business as usual.
Hello, I'm Mark Brown. Get more great ABC7 content by clicking the subscribe button for our YouTube channel, and download the ABC7 Los Angeles streaming app on Fire TV, Android TV, Apple TV, and Roku to watch on your TV.